Common gastrointestinal issues in felines. One common gastrointestinal issue is intussusception. Intussusception is when one section of the bowel swallows up or overruns another section of the bowel due to a fast-moving peristaltic wave during enteritis. So you'll see here on figure 714 that the direction of the peristaltic wave goes from left to right, from the proximal small intestine into the distal small intestine. So the distal gets swallowed up by the proximal. And it's basically a swallowed up telescope section of bowel. The organs of interest located within the body, the part of the body that's involved in this digestive issue, is located within the digestive tract, specifically in the intestines and the peritoneal cavity. Intussusception can also occur in the stomach, but it's more common in the intestines. The small intestine is located in the abdominal cavity, ventral to the kidneys, and caudal to the stomach and liver. The condition is acute idiopathic condition because it comes on suddenly during an enteritis attack or due to a foreign body within the digestive tract, and at times for unknown reasons. One of the reasons that it's very important to discuss intussusception is because it's a deadly condition that can cause severe pain to the animal and necrosis. If it is due to a foreign body, the intestinal wall becomes plicated and requires emergency surgery. So in this slide, we're going to watch a surgeon, Dr. G, perform intussusception surgery on a puppy.
And it's essentially to see if we can reduce it. So this is our intussusception here.
So that's the intussusception.
This piece of the intestine here is actually going on the inside on that piece there.
So he's going to pull this out and manipulate it, which is good because that means that the puppy didn't have to have any type of surgery to remove many parts of the intestine. So why is it important to discuss? Intussusception is important to discuss because, again, it's a severely painful condition for the cat. The signs and symptoms of intussusception is vomiting, loss of appetite. The animal becomes lethargic, abdominal swelling and pain, diarrhea, dehydration, and they could have a bloody stool. So there are several different diagnostic tests that you can perform. Abdominal palpation can be used to detect organ enlargement, thickened bowel loops, and gas. Abdominal x-rays, ultrasonography is used, and blood tests are used to determine complications from the obstruction. So what result are we looking for on the x-ray and blood test? The x-ray will show where the blockage is, and if there is no blockage, then the blood work will help to diagnose the inflammation. Blood work also helps to determine the level of inflammation, electrolyte imbalance, and if there is blood loss. And how should it be treated? It should be treated as a medical emergency, and instead of waiting to see if it clears, if there isn't a blockage, an enterotomy should be performed with the intent to remove the foreign object, and any necrotic tissue can be resected by an enterectomy if needed. If a primary infection, such as panleukopenia, causes the intussusception, then the infection should be treated and surgery should be done to repair the intussusception. What is the best treatment after surgery is done? Reestablishing electrolytes to normal value and IV fluids are necessary due to dehydration and blood loss that can occur. The use of opioids for pain relief help twofold by controlling pain and reducing the motility of the bowel. And are there any other diseases or issues that can cause the disorder? Yes, intestinal parasites can, and they are a common cause, as well as viral and bacteria infections. Another common cause is an abrupt dietary change. Thank you.